invite me for this IC. My talk is on the systemic comorbidities, and I think Dr. Murli has partly covered it already. Uh, yeah. So the systemic association is myopia is well known. We all know this fact, but it's more common in myopias presenting in the first decade of life. And Answorth et al. Have reported an association of 54% with or without ocular conditions, and the ocular association alone isn't seen 38% of the myopes. So the first in the list is prematurity and developmental delay. We all know that the refractive components of the eye, basically the cornea, lens, and the axial length, have the major growth in the late embryonic and early phase after birth. So this is the most crucial period where there is a correlation failure in the development of these refractive components, which influences the process of emetropization in prematurity and leads to myopia. The other hypothesis which has been uh, put is that in pregnancy with prolonged delivery or with constipation for a long duration results in increased turgidity of the cornea and the lens due to excessive congestion of blood in the head, which causes early refraction of the light rays and leads to myopia. There are many syndromes which are associated with the myopia. The first again in the list is Stickler Syndrome, which is partly covered by Dr. Murli. I'll just touch upon it again. It's basically a collagen tissue disorder where there is a defective or reduced amount of collagen tissue formation. There are typical features that the mid face is flat because there is the development of the bones in the mid face is flat. There is associated hearing loss which is conductive, and osteoarthritis of the spine causing kyphosis or scoliosis is seen. It is basically due to a genetic mutation, type 1, type 2 or type 3. Type 1 and type 2 are associated with ocular involvement and not type 3. Type 3 is a non-ocular Stickler syndrome. So the typical Pierre-Robin sequence is seen where we can see a flat mid faces, a cleft palate, glossosis, which is a backward placement of the tongue, micrognathia, that is the lower jaw is very small in size, and associated spine deformities like kyphoscoliosis. This, along with myopia, there may be associated cataract, glaucoma, and retinal detachment. The next in list is Down syndrome, which is again a genetic disorder. We all know that it's due to trisomy 21 chromosome abnormality. The children have intellectual disability, poor immune function, and the systemic disorders, which is mostly congenital heart disease. They may have epilepsy, leukemia, and thyroid disorders. The most common ocular findings seen in Down syndrome is the mongoloid stunt, epicanthal fold, sorry for the misprint, iris abnormality, strabismus, congenital nasal lacrimal duct obstructions, and refractive errors, cataract, amongst which myopia is reported to be around 13%. Marfan syndrome, again a genetic connective tissue disorder where there is long, thin arms, legs, and fingers. Anterior chest deformity, which is pectus excavatum with hyperflexibility of joints. There is subluxation of the lens, which is generally superiotemporal, but it can be seen in any direction. Myopia and strabismus are commonly associated, and we should always send the patient for evaluation of the cardiac evaluation for aortic aneurysm and mitral valve prolapse. Homocystinuria, again reported to be very commonly associated with myopia. It's an autosomal recessive disorder due to mutation of CBS gene. This basically happens because the body's inability to process the amino acid methionine. There is excessive deposit of homocysteine in the blood, and the patients have typical Marfanoid features. They also have thromboembolic phenomena. As you can see in this child, she has a malar rash, which is erythematous cheeks and golden colored hair with associated ectopia lentis, which is mostly inferonasal, and the children have osteoporosis and mental retardation. Noonan syndrome, again we can see the typical structure, the facial features. There's short stature with broad webbed neck. A heart defect is generally present with bleeding problems. An unusual chest shape, which is a very largely spaced, low set nipples. There's developmental delay, and in males, there's reported to be undescended testes. Myopia is associated in 40% and strabismus in 95% of Noonan syndrome. If you see a defect in the occiput or alopecia in this region, you should think of Knobloch syndrome, which is basically due to the occipital encephalocele. And these kids have generally have very high myopia with vitreoretinal degeneration and alopecia. The next is the Cohen syndrome, which is also called the Pepper or the Cervenka syndrome. It's again an autosomal recessive trait. There's obesity, craniofacial abnormalities, and intellectual disabilities. The children may present in ocular dysfunction as optic atrophy, microphthalmia, pigmentary chorioretinitis. There may be decreased vision in bright light, myopia, strabismus, nystagmus, and colobomas. There are many more in the list, amongst which the one which I have seen personally is the intrauterine valproate exposure. So a thorough workup is needed in a child who is presenting in the first decade of life with high myopia. We should take a thorough history to rule out any family history or any genetic association, and never examine a child without dilation. So you should not leave the child just by undilated examination, because personally I have seen a child who was seen by 3 ophthalmologists before, had a myopia. The child was seeing well, the parents were, he can pick up the smallest thing possible. So I dilated the child had a dislocated lens, and eventually on the pediatric workup was found to have Marfan syndrome. So a systemic workup, which is cardiovascular and especially the musculoskeletal system, should be examined, and a pediatrician opinion should be sought. So take home messages: consider possibility of systemic disease in high myopia presenting in first decade of life. We should always include high myopia as a recommendation for screening and referral to a pediatrician, because even myopia may be the first clue in conditions like Stickler's and Homocystinuria, which if diagnosed early and treated prolongs vision and life for the child. Thank you so much.